Hello and welcome to Early Bird by Amerisleep. My name is Dr. Devon Hoffman, and today we're going over side sleepers, pros and cons. We've done the research, so you don't have to. Now, sleeping on your side is one of the most common sleeping positions, and it has many different implications that you should know about if you want to get proper sleep. The first one is on your body's biomechanics. So sleeping on your side is not necessarily a natural position that we're normally in throughout the day, and it causes a lot of issues if you don't have the proper support because of the twisting and turning that you might be doing while sleeping on your side. Now, the pressure points of sleeping on your side are a little bit different. So generally while sleeping on our side, we tend to kind of curl up in this position with pressure on our shoulder as well as our hips. And a lot of times our back and our top hip tend to sag over the top, and that can cause some alignment issues and potentially some pain points for you throughout the night that I'm sure you have experienced before. Now, a couple things that we like to touch on are proper neutral alignment for our hips as well as our shoulders. So using a pillow to help support the knee and potentially even the arm can be great to support proper alignment and allow us not to curl over the top and cause some issues in our spine. In addition, making sure that your muscles are relaxed can be huge in basically decreasing your pain overall. A lot of times we hold a lot of tension throughout our workday or overexerting ourselves through physical activity. Making sure to intentionally focusing on stretching and relaxing muscles before bed can be great for side sleepers. One area that you might not have known about was organ positioning. Because we're actually not equal each side, we have a heart on one side, a liver on the other side. A lot of these issues can cause some things depending on sleeping on the right versus the left. So today we're going to dive a little bit into that on a couple different changes that can happen depending on which side you sleep as well. But real quick, let's go into the pros and cons of side sleeping. Pros include aiding in digestion, reducing snoring, and helping improve brain health as well. In addition, there are some benefits for pregnant women who have to sleep on their side. The cons of sleeping on your side include some of those alignment issues, some potential back, shoulder, and hip pain, some restricted blood flow, as well as some increased pressure on certain organs. In addition, making sure you have a supportive mattress can be huge in helping to reduce the amount of pain or pressure that you're feeling throughout the night. So making sure that you're trying different firmness levels, picking one that's perfect for you, and then helping to use it in a way that's going to support with the alignment positioning techniques that we talked about earlier to make sure you're relieving the pressure and not causing some of those malalignments. Now, going into the team left versus team right of side sleeper. For people that sleep on their left, it's mostly digestion. So you have improved acid reflux, better digestion, and better for women that are pregnant so that they don't have decreased blood flow. In addition, there might be some benefits for brain waste clearance as well as some heart health benefits. Now, the main benefit for sleeping on your right is reduced pressure on the heart. So that's kind of one of the main things for people who do have some heart issues. Potentially sleeping on your right could be more comfortable. That being said, all of these are very individualized, so pick the one that's most comfortable or what that you're used to and stick with that one. Some other interesting aspects is that side sleeping can actually help you stimulate the vagus nerve, which helps you basically stay asleep and is a good nerve to stimulate if you want to promote relaxation, and sleeping on your side has been shown by a couple studies to do that. In addition, side sleeping has great implications for respiratory health. This is a position we put in for a lot of people that have respiratory issues, so sleeping on your side can be great if you have some sort of respiratory issue. In addition, there are some heart health implications. Some people say that sleeping on your side can promote heart health, and there are some good studies and evidence to back that up. If you do want to transition to sleeping on your side, there are a couple tips that we would give you, and it's basically centered around being patient. So making some adjustments with your pillow positioning can be huge. Gradually shifting to more hours on your side and being very patient as you go throughout the process of being more side sleeper than back or front sleeper is very, very important because it does take a lot of time and you don't want to rush it. Now, real quick, we do want to stress the importance of having an optimal sleep environment to help this process go smoothly. So making sure that you have optimal lighting, making sure that it's not too bright, you're not looking at phones or screens before bed, and that you're also sleeping with a good mattress and supportive base that can help promote good neutral alignment of the spine can be crucial in helping all of these aspects kind of work together. Regulating room temperature is a huge one. Making sure that you're in a quiet and cold environment can be great to improve sleep. Making sure that there's not noise, and sleeping between 60 and 67 degrees Fahrenheit is a good temperature to keep the environment nice and cool, which has been shown to increase our sleep quality. Now we're going to go into some frequently asked questions. The first one being, is it healthy to be a side sleeper? And the answer is yes. There are a lot of research that shows a lot of benefits to being a side sleeper, and the articles attached in this study are great articles to read and look at, and do your own research as well to make sure this is something that you want to do. What is the disadvantage of side sleeping? So the main one is the increased pressure on the shoulder and the hips, and potentially the back if you don't use the alignment techniques we talked about. So make sure that you're using all of those aspects, and if you do have shoulder or back issues, potentially switch sides or look at some of the other positioning techniques. So are there any specific exercises that we use for side sleepers? So yes, there are. One of the main ones is the knee to chest stretch, which can help stretch out some of the low back as well as the hip muscles, and can be great if you have tightness from sleeping on your side. Lastly, is side sleeping good if you have an injury or if you're recovering from a surgery? So this kind of depends on your surgical protocol. Make sure you discuss this one with your doctor. But that being said, side sleeping can be great to elevate either a shoulder, a hip, an ankle on one side rather than putting pressure on it on your back or your front. Side sleeping can be a great option if you do have this sort of injury. So I hope this video was helpful. If you do want to sleep better, consider sleeping on your side, and I hope some of the benefits that we talked about make sense. And if they are making sense for you, then go ahead and try the techniques we talked about implementing side sleeping in to aid for a better sleep. Make sure to pair it as well with a supportive mattress and a supportive base. Thank you guys so much for tuning in to Early Bird by Amerisleep. If you did find this information helpful today, be sure to visit our blog for more helpful expert opinions and information on how to get the best sleep of your life. Until next time, sleep well and take care.